People reliably demonstrate a right hemisphere advantage for the processing of spatial stimuli, such as geometric shapes and their relations, direction of sense and navigation, etc. Posterior lesions that involve the temporal and parietal lobes tend to produce a variety of impairments of spatial cognition, such as the inability to recognize faces, failure to identify objects by touch, etc. The diversity of behavior changes following injury to the parietal lobe is related partly to its large expanse and its critical position, abutting all three of the major lobes. Anterior end of the parietal region includes the postcentral gyrus, which is the primary cortical receiving area for somatic sensation. Injuries of alterations to the parietal lobe can also lead to deficits involving more complex sensory processing. This is seen when objects placed in the hand opposite the injured somatosensory cortex can be felt but cannot be identified by touch and active manipulation. This is known as asterogenosis. Injuries in the parietal cortex beyond the primary somatosensory cortex of the postcentral gyrus affect interactions between sensory modalities. This is seen in visual or tactile matching tasks that require the participant to visually identify the object that is touched/reached for that is first perceived visually. Prosopagnosia, or face blindness, is a rare symptom that may occur after brain damage. Prosopagnosia is the inability to recognize your own face as well as the faces of relatives and friends. No amount of remedial training restores their ability to recognize anyone's face, yet the ability to recognize objects may be retained, and you may be able to recognize familiar people by their voices. Acquired prosopagnosia is caused by damage to the brain, particularly the fusiform gyrus. Developmental or congenital prosopagnosia is present from birth. About 2.5% of the general population is sufficiently impaired in processing faces to meet the criteria for congenital prosopagnosia. This runs in family, as it suggests a genetic aspect to the disorder. It's associated with diminished activation of the fusiform gyrus and reduced white matter connectivity in the verbal occipitotemporal cortex. Faces simply lack meaning in the person's life. There is no confusion or disorientation associated with this condition, nor is there evidence of intellectual disability. Visual acuity is maintained except for one area of the visual field where the person is blind. The right hemisphere is more important than the left hemisphere in recognizing faces. Shunning in the right hemisphere during the WADA test can cause difficulty in recognizing faces. Split brain patients do a better job of recognizing faces when those faces are presented exclusively to the right hemisphere. Both hemispheres have some capacity for recognizing faces. Therefore, the most complete cases of prosopagnosia are caused by bilateral damage. The fusiform gyrus is a region of cortex on the inferior surface of the brain where the temporal and occipital lobes meet. Cases following prosopagnosia almost always involve damage here. At the other end of the spectrum, we find super recognizers, who are really good at recognizing faces. These people are actively recruited by some police forces. Prosopagnosia may be accompanied by additional forms of agnosia, which is the inability to identify items in the absence of specific sensory impairments. Someone with agnosia may be able to describe the object in terms of form and color. This may occur after localized brain damage. The fusiform system appears to be crucial for identifying individual members of large categories. Aphasia is an impairment in language understanding and/or production that is caused by brain injury. About 25 to 50% of people who suffer a stroke will experience aphasia as a primary symptom. Voice speech difficulty is considered to be one of the core warning signs of a stroke, along with dizziness, altered vision, confusion, or weakness/numbness of one side. 90 to 95% of aphasia cases are the result of damage to the left cerebral hemisphere. In cases where left hemisphere damage is less severe, the individual may show paraphasia, which is insertion of incorrect sounds or words along with labored, effortful speech production. Entirely nonsense vowels, known as neologisms, may be generated via the insertion or substitution of one or more phonemes. Conversation reveals another important aspect of speech, which is its fluency/ease of production. Non-fluent speech, talking with considerable effort in short sentences and without the usual melodic character of conversational speech. Most people with aphasia have trouble reading, which is known as agraphia, and writing, which is known as alexia. Brain damage that leads to aphasia also produces apraxia, which is a distinctive motor impairment even though there is no muscle paralysis. This involves a great difficulty in executing precise sequences of movements. People with aphasia seem to outperform unaffected people at detecting when someone is lying. Sensitivity to lying may result from a focus on facial features of speakers. Broca's area is a region of the left frontal lobe involved in the production of speech. The left anterior lesions that include Broca's area produce a type of aphasia known as non-affluent aphasia, which is a language impairment characterized by difficulty with speech production but not with language comprehension. This is also known as Broca's aphasia. This is seen when automatic speech is preserved, such as greetings and swear words. Many people who suffer from non-affluent aphasia also have hemiplegia, which is paralysis of one side of the body, usually the right side, which is controlled by the left hemisphere. Sometimes there is unilateral weakness called hemiparesis rather than full paralysis. Warnick, on the other hand, described a form of aphasia resulting from damage to a more posterior aspect of the left hemisphere, centered on a region of the superior temporal cortex, now known as Wernicke's area. People with fluent aphasia, or Wernicke's aphasia, produce plenty of verbal input, but their utterances, although speech-like, tend to contain many paraphases that make their speech unintelligible. May involve sound and or word substitutions. Neologisms are also common. Anomia is the inability to readily name persons or objects. It is also common. Paraphasis and speech errors occur in a context that preserves syntactic structure, although sentences seem empty of content. The ability to repeat words and sentences is impaired. People with fluent aphasia have a difficult time understanding what they hear and read. The most prominent brain lesions in fluent aphasia are in posterior regions of the left superior temporal gyrus and partially extend into the adjacent parietal cortex. When word deafness is more apparent than reading impairment, damage is more likely in the superior temporal lobe and tracts from the auditory cortex. When word blindness predominates, greater destruction of the angular gyrus may be evident. People with fluent aphasia typically do not exhibit hemiplegia because the motor cortex of the precentral gyrus remains intact. Global aphasia is the total loss of ability to understand language, or to speak, read, or write. This is what the girl in the beginning of the chapter had. People suffering from global aphasia may retain some ability for atomic speech-like sounds, especially emotional exclamations. Can actually utter very few words, however, and no semblance of syntax remained. Generally results from very large left hemisphere lesions that encompasses both anterior and posterior language zones. Frontal, temporal, and parietal cortex and the supramarginal gyrus are also affected. The traditional connectionist model of aphasia, known as the Wernicke-Geschwind model, views language deficits as a result of a disconnection between the brain regions in a large network. Each of these regions is viewed as a module that serves a particular feature of language analysis or production. According to this view, when a word or sentence is heard, the auditory cortex transmits information about the sounds to a speech reception mechanism in Wernicke's area, where the sounds are analyzed to decode what they mean. For the word to be spoken, Wernicke's area must transmit this information to the expressive Broca's area, where a speech plan is activated. Broca's area then transmits this plan to the adjacent motor cortex. Arcuate fasciculus is a tract believed by some to connect Wernicke's area to Broca's area. Conduction aphasia is the impairment in the production of words and sentences. Diffusion tensor imaging, or DTI, is a modified form of MRI imaging in which the diffusion of water in a confined space is exploited to produce images of axonal fiber tracts. An alternative perspective, the motor theory of language, proposes that the left hemisphere language zones are motor control systems that are concerned with both the precise production and the perception of the extremely complex movements that go into speech. The anterior left hemisphere programs the simple mnemonic units of speech, and the posterior systems are responsible for stringing speech sounds together into long sequences of movements. When we listen to speech, we are using elements of this system to perceive the very rapid sequence of facial, throat, tongue, and respiratory movements that the speaker is making. In a way, speech sounds are simply an auditory representation of a series of rapid oral facial movements that we perceive using our own oral facial movement-making machinery. Researchers can probe the brain's language circuitry through two experimental approaches. One is stimulating the discrete regions of the cortex to measure associated changes in language functioning, and the other is asking participants to engage in specific verbal behaviors and measure associative changes in brain activity using functional imaging. By observing changes in brain and behavior during stimulation, the person is conscious and under anesthesia. The surgeon can identify and map the brain regions serving various functions. And even though these electrical stimulation maps provide excellent spatial resolution, the cortical surface is exposed during major brain surgery, which can be a problem.